So Kelly is perimenopausal. She's young for that. We're going to direct more towards hair loss in women, right? There are some very basic causes of hair loss in men and women. For women, they can also have androgenic alopecia if they are making too much DHT. That's the driver of that. We looked at her testosterone levels and they were low. We don't have a DHT level. In women, menopause or perimenopause can be driving hair loss due to drops in estrogen in particular. We're going to look at those levels for her. We don't have that today. Nutritional etiologies are often big. I see that you run a little anemic. I saw that on your blood work.
Yeah, I took the iron.
We'll talk about that. There's good and bad iron to take. Some that never even gets to hair follicle. Like, what's the point? And then their stress can cause it. Hair products can cause it. Hair dyeing can cause it. Illnesses can cause it. And you had a long ago history of an autoimmune disease. It's quiescent now.
Right.
You're not on any more meds. You're really working on your health. But you've seen overall loss of hair. She's reporting it's hair loss. Men see it more in a pattern. Women can see it, if it's not androgenic, kind of overall thinning. There might be patches as we look through and assess her scalp. First, because I haven't met Kelly before, I'm going to go ahead and take a look through her hair and see what the pattern is of her loss. Overall, she has a paucity of hair follicles in general, meaning that the hair she's making is long, it has good integrity, but she just doesn't have the fullness. It's not very dense, is another way of saying that. I'm also looking at the health of the scalp. If I see any signs of inflammation, that would be atopic dermatitis. So what I'm looking for is an overall pattern. If I see any areas that are completely bald, which she does not have, at least not on this side. Women, typically menopausal, will start thinning, not like men here at the hairline. They're going to thin here. That's an estrogen effect. And she definitely has even less hair follicles up here. So we're going to focus on that area. You can see this would be her hair without having the extensions in. So that's quite thin. That's, something's happening in her scalp that is detrimental to the hair follicle. The back of the head is going to be preserved, which you do have your healthiest hair back here. So these needles are even smaller than microneedling that we do like on the skin.
Right.
So, most patients say they feel it, then it can wince, but it's not like painful. But there are some areas that are worse than others. So that's why we're going to show you at any time, you can inhale and kind of take the edge off. So this is how they come. They're little exosomes that have been taken from umbilical cord stem cells. They're directed at hair loss and things that happen as we age. So they're a pretty powerful little couple cc's biologic. They're better than PRP because PRP is just spun down from your own blood and it still contains a lot of whatever's causing the problem in your scalp. So for her, there's really no sense. It's a very diffuse pattern other than more significant through here, which is what we see in menopausal women. But women are more complex. Their hormonal balance is more complicated. They're more likely to have thyroid problems. So it's a more thorough investigation. They're also more likely to be anemic or micronutrient deficient, which we're going to be checking with her. We know she's a little anemic, but your red blood cell size is actually okay, so that's not too bad. There's some more investigating I'd like to do with her. For women, we really need to know their thyroid status, their nutritional status, pregnancies, history of hair products and dyes and weaving and all kinds of things that can tug on the hair. You can't always fix the root cause with exosomes. For example, if someone has tinea capitis, which is a fungal infection, you got to treat that first. But anytime you have figured out the etiology of the hair loss and you're working on that, they're an excellent supplement because they're going to be bringing in and helping the nutrients, the blood supply, all of that. So for women, the situations that exosomes can help is where their scalp has been very stressed for whatever reason. You are fixing or have fixed the underlying reason that caused all the hair loss, and they just haven't been able to achieve regrowth of the hair. So, like with anything, you have to remove the offending agent and figure that out. And then you're going to put in the nutrients to help regrow. These are going to be way better than you're going to get a faster result if you combine this with, say, red light treatment. I wouldn't prescribe it if the scalp wouldn't take it well. For example, if I can't clear a fungal infection, if the scalp is not in good enough health to receive it, say you've got too much dandruff, I would work first on the topical inflammation and getting rid of the problem, the offending problem topically. Then when it's ready, I'd apply it. Women's hair loss has not really been addressed over the years. It can happen after pregnancy, for example. And so dermatologists say, oh, you're just in a big telogen effluvium phase. Everything's going to fall out and it's all going to regrow. Women are kind of brushed off saying, deal with it. It's not the same as, balding for men. So not a lot of things have been put out to help women other than getting hair extensions or, other ways. But hair for men and women is very important for their confidence, their self-esteem. And when you start rebuilding something that they have felt bad about, it has other effects in their life. So it's kind of it's a win-win. So for women in particular, I think that as soon as they start seeing loss, the sooner they address it, the better. Women should come in and have it looked at when they start noticing. The biggest thing I hear is their ponytail size. They have less hair that they're pulling back in a ponytail. If they're seeing tons of hair in their shower, in their brush, and it's not a passing phase. If they've had a bad infection and their hair's not growing back, we saw a lot of hair loss with COVID. If they're starting to even do their regular hair style and they can see their scalp through their hair. So most women are used to being able, they have one part and the rest of the hair is full. When people see the scalp, no matter how she does her hair, you're seeing her scalp through the hair. That's a red flag. Well, interestingly, for women in particular, I ask that they do not come in while they're having a period. Women are very, very sensitive to pain during a period. Anytime you're piercing the skin, you don't want anything to cause increased bleeding. So stopping their ibuprofen, headache medicine. A lot of women are taking fish oils, which is great for skin and for hair, or coconut oil. Those things I have them stop a couple days before, just so I can get a good idea of how their scalp is responding to the microneedling. And then they can't really stop birth control pills, but we will look top hormone levels. There are even topical estrogens that I can put on menopausal women's scalp if that's the main etiology for why they're losing. Yeah, general blood panel, the CBC is what tells us about the red blood cell size and anemia. I will have known if there's any other agents that we have to worry about. Women usually want faster results. So I guess I'm more cautious about setting expectations with women. They might need more treatments. I'll do a second one in about 4 to 6 weeks, and then a third one again in 4 to 6 weeks, and really nourish the scalp depending on how much they've lost. It's just like with weight loss, people are so excited to get to the end result that they get disappointed if they're not getting fast results. Definitely. I mean, nutrition, a lot of your antioxidants, your NAD, things that vasodilate, things that bring in blood vessel oxygen, like red light therapy. We've talked about that, peptides. So, yeah, there's things you can use to augment in between. And then, of course, cutting out any offending agent that might be causing it. Okay. Exosomes come in 1 cc vials. And when they are thawed, because you don't see any more ice crystals in them. You need to use for exosomes a 23 gauge or larger needle to pull into your syringe. I use a 5 cc syringe, but it can be any size based on whatever device you're using. This one fits best in my device. And then oftentimes I'll just do a quick little wash of the vial to make sure that we've got all of our little exosomes, anything that was stuck maybe to the wall or the vial. When we're dealing with intradermal injections, we don't worry about air bubbles. That's only for IV use. You will feel the little square pushing on your skin. It just creates a vacuum so that when we suck the skin up into the device, it allows for the cells to be delivered exactly the depth that I want them to be delivered. Depending on the scalp, when you're delivering exosomes, you want to go all the way down to the dermis, the base of the dermis, so that you're flooding the follicles and the vasculature with the exosomes, and then you might come up again. So that's going to be about 1.8 millimeters. So let's start. When I start at the front, it's shallower, so I won't quite go to the 1.8. I'll start at 1.2. Okay, so these ones, you'll get a sense of kind of it's sort of sharp, but then it's quick. The hairline itself, you can see she has some little baby hairs. The biggest problem I see in this patient is that she has a very sparse population of hair follicles. You can see where the hairs come out, they're growing long, but she's lost that density. It's called a paucity of hair follicles. You can also see some of her scalp doesn't have a very brisk capillary return. So that tells me that something is, that's might be what's stressing the hair, is that it's not getting very good blood flow. The second thing that I see is that some of the hairs even coming out are struggling. At our 3 and 6 month follow-up, we're going to pay attention to those factors. Okay, so I'm going to start with the first one. It tends to hurt more across the front, but this will be the worst of it. Here we go. You ready?
Oh, it's fine.
Good. So what I look for is how well your scalp is responding. You can notice here that she is starting to get some pinpoint bleeding, but it was not brisk right away. As we were describing, that it looked like she's had a decline in blood flow. We might see it be more brisk towards the back. And then what I do is I'll do just kind of a linear pattern all the way across. I'm using the shape of the head. So I'll go all the way across and all the way across, and then I'll go back through for areas that might not have responded as well. And also, as I go back further, I change my depth a little bit because these ones are spicy because it's shallower. For example, what I'm looking at right here, there's hardly any hair growth right here, as opposed to, say, through here, where it won't put as much product probably. Um, so what you'll feel a little bit of bleeding, dripping, whatever. I'm keeping control on that. I'll clean it before you go, but it will just need to stay for the night. It won't hurt to, sleep on it or anything. So I always say if someone has pets, they need to clean pillow, clean bedding, because there are some things that, since we haven't done all the testing, there are some things that we don't want to just reinfect after we've just treated something. Okay, you're doing good. So, as I thought, some areas you have more robust bleeding. That tells me it's just a little bit of a healthy area. But I was telling these guys earlier, you know, any part of your head could be at any stage of the hair growth cycle at any time. And then now we're hitting it right at the time that you're going to go into a growth phase. So we'll see. We'll see. It's very hard and not that important to know what phase it's in when we deliver the exosomes. It's more important that we get it everywhere and then we help nourish the scalp, because it's all these little guys are just in trouble. So anything that's increasing circulation, scalp massages, I was telling you, I brought one in to show Kelly afterwards. Red light therapy, specifically infrared, that penetrates deeper than just your average red light, saunas, nutrition. And then just because I'm in regenerative medicine, I do like to use the tools we have at hand, which are our peptides. So I'll do a combination of topical or injectable. And then with any topical, if they have a large inflammatory component, I will add an anti-inflammatory a couple weeks after. You don't want to disrupt the exosomes doing what they do. So remember I was saying exosome is a name for a packet of material. So the stem cell carries around these packets. Let's call it the cargo on the ship, right? When the exosomes are released, these packets of growth factors and anti-inflammatories and anything that will mitigate an injury or a stressed area, the exosomes release these molecules and they go to work decreasing inflammation, preparing the area to bring in new blood vessels. That's called angiogenesis. We need oxygen for anything to repair. It upregulates all of our growth factors that will help repair skin trauma. The hair follicle itself responds specifically to certain growth factors that we've seen in these exosomes that we haven't yet figured a way to put those into a topical. That's why, we're getting way better results when you add in exosomes, because you've got the VEGF, that's a VEGF or growth factor, and then you're getting a lot of ones that only our body typically makes. Exosomes can be targeted to the part of body you're treating. So they're going to be higher in concentration in, say, hair growth factors versus joint growth factors versus skin growth factors. So initially, they're activated by the trauma we're creating with this microneedle. So we're dropping down into the dermis where you're getting bleeding. We've now pierced the hole. that activates that whole cascade response that our body has to trauma. And then that activates the exosomes. The exosomes respond to that and say, oh, okay, let's open up, put all our growth factors out that need to help this situation. So once the exosome opens and is responding, it goes to work. Very few, a very small percentage will take off in the bloodstream and go away. That's a little different for stem cells because yes, they're acting to the environment that we are injecting them to, but they will take off in the bloodstream and go find other areas that need help. The exosome doesn't have that chemotactic. That's a cellular signaling. So the stem cells will, as blood is flowing by, they might get signaled to go elsewhere. And the exosomes are already being activated here in place. Mostly the area that I need to cover, severity, like, she's a severe case. So we're going to figure out other ways to help her scalp because it's very distressed. Once we figure out more about what's going on, I'll typically set the expectation that if you just did this and then do all the other things, the nutrients and everything, you probably will see some hair growing in 6 to 8 months. But if we do a couple more to boost it every 4 to 6 weeks, then you're going to get a more profound response. You can't overdose on exosomes. It's a biologic product. It's a human product. Anytime you're dealing with products that are biologics, there's always the possibility that something new could be found or developed later. Exosomes are my favorite because they get metabolized down and away. But you know how we test every biologic for viruses, and what if there's a new one? We weren't testing for COVID before 2020. We weren't testing for HIV before 1985. There's always the potential that something could come up, but that's why it's so important to choose a product like this one, where the source is very pure. So the mothers are tested, the fathers are tested. They're very, very careful in selection. So they're not at risk for some new hepatitis because they don't have tattoos or, the stranger things. They haven't traveled to Siberia or whatever, right? They used a good, healthy pool of parents and healthy babies. So I feel good about that. I would not do this if someone was just getting over an illness. I would reschedule it just because their immune system is otherwise occupied and they're getting their healing. And then you could confuse, again, fever, chills, recurrence from that illness that had something to do with this, which it should not cause, but I wouldn't do it in proximity to an acute illness. After getting a microneedling treatment with exosomes, it's very important to let the exosomes set where we've placed them, to let the opening that we made with the needle heal over. So sometimes you'll see little scabs, and we ask the patients not to wash that off tonight. It's okay if you scratch it or something, but that is helping the little pores that we made with the microneedle to hold the exosomes in and close over. So gentle activity tonight, nothing strenuous, clean pillowcase and bedding, and rinse. If people have itching, which some may, it's okay to do a gentle rinse with cool water tonight, but it's not a problem to just wait till the morning and then get in the shower. Still no shampoos or soaps, but you can run some cool water through your hair and get kind of the rest of the little scabs and blood off. It will help to do a little bit of scalp massage,
Sure.
nothing rigorous, but the main thing is you want this all to heal up so it doesn't get infected. That takes 48 to 72 hours. Water will hurt that, but anything else would. So no hair
Sense.
products. Putting a hat on is sort of constricting, so just let it breathe. The sun is fine.
Really?
The sun is very healing. It will not, the big thing is infection. You want these to close, let the exosomes do what they do and not get infected.
Okay.
So that's why products might clog the pores or disrupt the pH of what the exosomes are doing. And then the other thing I always mention is that includes no hot tubs, even if your hair is up. There's steam, there's chlorine, no saunas, no. Gym is bad just because, well, for one, they tend to, there's a lot of germs, sadly. But also, when you're there, you're working out and you're getting sweaty.
Sure.
And we just want to let your scalp rest. You may feel a little bit of soreness, like kind of raw, but it should not hurt.
Okay.
You should not get a fever. You should not have any drainage. If that's the case, you would call me. That would be very rare. I've never seen that. But as with any procedure,
You never know, right?
you gotta say it. And it'll be on the post procedure information. I'll email you. It basically says that you can go ahead and take Tylenol, ibuprofen if you're sore.
Right.
You can go back on your vitamin E, herbs, vitamin D, all the things that can make you bleed. That's fine. Go back on your Nutrafol for nutrients. If we do another round, we'll see. Some areas might respond better than others. Some areas might be in a different phase of growth right now. And so they may have no response. It looks to me, I think the biggest problem is that your scalp was really not getting good blood flow to the follicle. There's an estrogen component. It's just struggling. So help it out. And exosomes are the best nourishment you can give it.